we have Dr. Teoh Poey, Emergency Physician and Trauma Fellow from Hospital Sungai Buloh, to conduct a high-quality data entry demo and hands-on practice. It is an important session for your MTR challenge later on, so kindly be attentive.
Right. So good afternoon, ladies and gentlemen. Salam sejahtera, tuan-tuan dan puan-puan. It has been a very long day, and I think this is the last lecture of the day lah. Right. Boleh dengar semua? Boleh. So this part of the lecture of today is very important because this will also be determinant on your performance on your next challenges lah. MTR challenges, you got MTR challenge 1, 2, and 3. So what we will do is actually to get you on board onto the MTR punya dashboard so that you can see what information that is required for you to be to enter into the system. So before we start, I will have a bit of a short introduction lah to what is to high quality data entry. All right. So okay, next. Okay, so to my short lecture, this is the outline. I'm going to introduce you a bit to the high data entry, quality data entry and the components of it and a key message, and hence after that we will go into the session. All right. So why it is important to have high data entry, high quality data entry? Because it not only involves an accurately and efficiently input of information, but this information at the end of the day is translatable to what our future future outcomes and what our expectation lah in the future kan. So the data has to be accurate and it has to be efficiently placed into the system. All right. So the components, of course, I think this has been repeated many times by many speakers. Okay, the first one is accuracy. Second is organization, validation of the data, the time management, software proficiency. That's the reason why we are here today. And the last one, of course, is the quality control. So all of these components comprise. These components are very important in collecting quality punya data. All right. So accuracy. How do you improve your accuracy? Number one, always double check. Okay, double check your work for any errors and inconsistency. Pay attention to details. Okay, if you are unsure, check back. Selalu check balik. Okay, jangan don't presume, don't hantam je lah. Kan? So when you start doing that, then the data is not reliable anymore. It is not accurate. Okay, next we go to organization. Of course, a person who enter the data has to be organized. Yeah? If not, you will be doing redundancy. There will be redundant of work. That means banyak sangat entry patient yang sama ataupun entry patient yang sama tapi data yang berbeza. So you have to be organized. You have to be organized. All right. Next, of course, when you enter the data, there's some sort of validation that has to be done lah. Okay, you have to cross-reference back to bila you before you dispatch that particular data. You have to check back again whether your data is consistent with the hard copy that you have from your hospital. All right. So kena validate balik. Of course, then again, this is data entry is a very time-consuming thing. So you have to manage your time efficiently lah. If you do it too long, you might be burnt out. So you have to manage your time lah, manage your time. So if you get tired, if you get bored of it, then probably you want to go for a rest, kan? Dapatkan orang yang seterusnya untuk sambung buat lah. So the time management is very important lah. Alright. And this is the reason why we are here today for the software proficiency, so that we can get to know lah the MTR punya layout of the dashboard and what information that you should seek for inside your medical record. Alright. So once you are proficient in the software, of course the data entry will be easier, and it will aid you lah in your senang sikit lah kiranya. Alright. And last and not least is your quality control. review and verify the data entry periodically. All right. So this is to identify if it has any errors or discrepancy. All right. So next, we will go straight to our platform, MTR punya registry. I think for those of you who have the data, who have the access to the MTR, can you please log in into your laptop right now? All right, my HSgB. So if you don't have, then probably you can share among table lah. At least satu table tu ada seorang yang ada access pada MTR.
Alright, so semua orang kalau dah dapat access to MTR, you can actually use your own hospital access to the MTR. Okay, those who don't have, you can see our Zoom. There is a password for you. The username is a general access. You can access to it, and Dr. Teoh will continue with the data entry.
So we give you a bit of time, 1 to 2 minutes for you to get on board.
All right. You go to your Zoom. In the Zoom, in the chat box, there is a link. Click that link, username, key in, password, copy and paste. Then you will have the platform video. Okay. Sure. May I have a show of hand? Who has not entered MTR platform until now? All right, you have that. Just one enough already for one table. All right, good. Any problem here? Can you enter? Okay, good. All right, I can see mostly you have already got access into the platform. Okay, good. So Kedah, Melaka ada.
So any table with issue, Dr. Teoh boleh tolong?
Before we start.
Alright.
Alright, good.
Alright.
Semua boleh, eh? Alright, good.
Alright, so what you will see is this dashboard that is projected on the screen. So yang ini adalah your MTR punya dashboard. MTR dashboard. So when you look at the dashboard, you have as you can see on the left of your screen is the total notification lah, kan? Notification. So from here you can see how many cases that is pending. Maksudnya case-case yang you dah masuk tapi you tak hantar lagi, you tak dispatch lagi. So belum lengkap. Alright. And the one in grey is the one that you had already submitted and dispatched properly lah. And then also you can see on the right side kotak berwarna merah pending word list, itu kerja-kerja yang belum diselesaikan. Alright. Okay. So now I think every table has an orange envelope, kan? Setiap meja ada envelope color orange, betul? Okay, dalam envelope color orange tu dia ada satu case. Case ni case number 4. Right? Okay, kita akan pakai case ni untuk data entry lah. Untuk practice session. Alright. So, semua dah dapat? Semua dah ada kertas? Okay. Alright. So now we will go to the patient. We click on the patient option. Saya punya tak buka pula. Alright. To start, you have to click on the patient. Ada nampak? Bawah dashboard sebelah kiri sekali yang color hitam putih tu patient. So you kena click patient. Okay. And then you click on search and add. Okay. You will come to this page. Alright. So when you reach this page, apa yang you buat adalah you masukkan nama pesakit. So this is as for now, this is a special code yang kita pakai because this code will be carried on for your MTR challenge as well. Untuk kes-kes yang sebenar, you pakai nama yang telah didaftarkan secara rasmi mengikut dalam you punya IC, you punya birth cert, you punya passport. Tapi disebabkan untuk because this is a training punya session, so we will enter according to this code lah. Okay, so the G apa tu? Okay, G98-0P04. G98, kalau meja kalau depan ni macam meja Dr. Sani ni dia group 11. So pesakit dia akan coding G11P04. Kalau meja you 03, you akan G03 patient P04. Alright. So this number is unique to your table so that tomorrow when we conduct the challenge, dia akan bergantung lah kepada kumpulan-kumpulan meja ni. Alright?
Oh, you are at this stage already.
Faham? So this is case number 4. Your PO4 memang dah ditetapkan. Yang G0 something tu bergantung kepada meja you sekarang. Kalau meja you G24, G24, G28, G28. Untuk sekretariat G98 lah.
For this patient, for like as example, for this table is group 10, G10, P04. Got it? All right. That will be your patient's name. No worry if you have accessed already previous. Let's say your hospital has already accessed. This is not a training module. You are using the own hospital access. No worry, just access it. In the end of the event, we will delete the data. So it won't kacau your data analysis in the future. So the patient, we purposely don't give name on the paper, but the patient is according to your table. Important, because during MTR challenge, you need to key in properly. If you don't key in properly, I cannot analyze.
Right. So next is the IC of the patient. You can key in as per projected. Okay, IC dia 93040427145555. You can key in accordingly. Okay, dapat dah? 930427145555. Alright. So once you had key in, you will notice there's a green button. Ada butang color hijau di sebelah kanan hujung. Okay. Alright. So you add new patient dekat situ. Click add new patient. So once you click add new patient, you will come to this platform. Okay. This is the platform where you will start to enter your data entry. Semua orang dah sampai ke platform ni?
P12, P04.
Yo, I think the last table.
Okay, coming to group 17, the rest can proceed.
Boleh Tak ada yang tertinggal bus Semua on the bus Alright. So, we go to section number 1. Okay. So, the section number 1 will involve the patient demographic. Okay, patient demographic. The first section, the first option in the section 1 is the reporting center. So reporting center ni bergantung kepada which hospital you registered your MyWHDW tu. Kalau you register dekat Hospital Klang, dia Hospital Klang. Kalau HSgB, Sungai Sultan Bayar, dekat Sultan Bayar saja dia boleh access lah. So disebabkan akaun ni didaftarkan di Sungai Buloh, maka Sungai Buloh lah yang kita boleh access. Alright, so click accordingly, no problem. Alright. And then you reinsert back nama pesakit tadi. Yang tu group berapa? P04.
So you can actually log that.
Okay, you get the name correct? Is the name? Okay, correct. Boleh nama dapat dah? Alright, seterusnya kita akan masukkan IC number. Apparently the system had detected that the IC number is similar, so dia dah tak boleh masuk. So upon each group you create je whatever IC number, tapi make sure the IC is logical lah, sebab this system can catch IC yang tak masuk akal. Okay, alright. And please specify the document type as well. IC, okay, you can use IC, you can use my card. You can use my kit, passport. Okay, that is the document type. Okay. Next, we go to the section number 1, number 3, which is your hospital registration number. I understood that certain centers do have 2 registration number. One of which is your ED registration number. Another one is your hospital registration number. So what we require here is your hospital punya registration number. So when you go back to your center, always use the hospital punya number, bukan the ED punya registration number. Okay, alright. Next, I mean the date, the age, the gender, and the nationality is all auto-generated accordingly lah. Dia daripada dimasukkan IC tu dia dah auto-generate. Alright. So Malaysia, we still have male and female only, okay? Dia tak ada kategori unknown, unsure or whatever. So it's male or female. Alright. So next. Dah selesai section 1? Ada masalah apa-apa ke? Tak ada? Okay. So if there's no problem with section number 1, we'll go to section number 2. Section number 2 is important when we will go into section number 2 is regarding your injury event. Alright. So number 1 is your date of injury. So when you click the date of injury, okay, dia akan keluar calendar and also the time. Alright. So now is the time that you rujuk balik kepada the case number 4 that we gave to you. Alright. Time of injury. The date of injury itu bila? You tengok daripada you punya PAC punya call lah, kan? Okay, so date of injury here is the 5th of July 2023. Betul? Betul. Alright. The next one is the time of injury. Time of injury. Dia ada specify tak in any of these document? If it is not specified, you can use the best estimate punya, best estimate time lah, best estimated time. Okay. Okay, misalnya patient ni dia tulis ni cuma response date 5/7/2023 pukul 6:10 pagi. Alright, so we presume that the incident probably occurs half an hour before. Okay, so kita ambil pukul jam 5:40 pagi. Okay, tak ada masalah. If you are not sure, you always can take the estimate of the best estimate of your date of injury and time of injury. Alright, pukul 5:40 Alright. So once you have entered that, then next for section number 2 is the dominating type of injury. This is when you have to get familiarized with your case lah. So you kena baca case note ni. Okay. So case note ni adalah case di mana MVA motorcycle versus car. Betul? Betul. Alright. So kalau motorcycle versus car, apa yang kita expect? Patient ni lebih kepada blunt injury lah. Kalau tengok daripada segi kecederaan pun lebih kepada extremities dekat dia punya upper and lower limbs kan. So dia tak ada kata penetrating to the heart, to the lung or to the abdomen, dia tak ada katanya tu. So for this patient predominantly your injury will be blunt. So kita tick on blunt. So once you click on blunt and then kita bagi ke section dia akan keluar mechanism of injury. So yang ni adalah transport related. So kalau you click on the drop box tu, dia akan ada banyak mekanisme lah di mana you boleh pilih. So untuk case ni adalah transport related. Okay, untuk case-case, can you click on the drop box again? Drop box. Klik. Okay, so kalau kita ke bawah, scroll ke bawah. So untuk, alright. So you can choose accordingly lah. Okay, accordingly to the mechanism of injury. So for this case, the transport related, if otherwise you have other choices of mechanism that you can choose. So if you choose transport related, automatically this chart will come out where A versus B. Okay, A asterisk is pertaining to your patient. Ya, pesakit yang terlibat sekarang kita panggil A. Let's say kalau motorbike versus motorbike, pesakit pertama Ahmad. Kita pakai A asterisk. Pesakit kedua bila masuk data, dia akan jadi A asterisk juga. Okay, so A is your patient. So what happens? Okay, yang ni kalau pesakit ni dia motorcyclist, so kita akan pilih A motorcycle versus car. Okay. Okay, so there are other options as well. Okay, patient ni dia motorcycle, motorbike, motorcyclist. Okay, so motorcyclist versus car. The next, dan dia akan tanya sama ada kenderaan ni adalah autonomous atau tidak. Kenderaan-kenderaan yang autonomous. Pernah nampak kereta yang pandu sendiri? Certain vehicle nowadays are autonomous. Misalnya macam kenderaan macam Tesla and all, those are autonomous punya kenderaan. Okay, untuk motosikal, of course, it is not autonomous. And next, you have to determine the position of the patient in the vehicle. Sama ada patient tu penunggang, orang yang bawa motosikal atau menunggang di bahagian belakang. So, okay, so untuk pesakit ni dia adalah the sole rider. So he is the motorbike rider lah, motorcyclist. Alright. So these are the components that you put. If you have extra data, okay, ataupun ada maklumat lebih, dia jatuh motosikal Chris, kan, motosikal Chris, make of the vehicle, boleh letak situ motosikal Chris. Okay, model of the vehicle, Chris MR1, boleh tulis situ MR1. Kan, kalau you lagi hebat, you boleh trace the year of the vehicle, lagi bagus. Kalau ada lah, kalau tak ada, dia tak wajib. Alright, tak wajib. Okay, next, section number 2, number 5. Okay. This we have also to key in. We can key in untuk safety devices use. Okay, whether patient ada pakai seat belt ke, ada pakai life jacket, helmet, or child seat. Kalau dia tak pakai, terang-terangan dia tak pakai, you pakai not use. Kalau you tak pasti, unknown. Okay, faham? Alright. So untuk pesakit ni, I think according to the PAC punya report on page number 1, if there's any use of safety devices, it was stated that there was no safety devices used. Betul? Okay, so patient ni kita akan klik kepada no, not use lah, not use. Alright. Next, number 6 is the intention of the injury. Okay, so intention of the injury. So this is a motor vehicle accident. Kita akan klik pada unintentional. Alright. Alright. So number 9, kejadian lokasi. Lokasi kejadian di mana? Okay, kalau case ini yang di mana accident ni berlaku, dia berlaku di jalan raya, di on the road lah, on the road. So we click on the road. Alright. So that clears your section number 2. Ada masalah ke section number 2? Kalau tak ada, kita pergi ke section number 3, okay? Alright. So section number 3. Section number 3 is regarding your out of hospital care. Alright. So untuk pesakit ni, if you tengok dia ada laporan MACC. Okay, so patient ni dibawa masuk oleh ambulance lah. Ambulance pun ada macam jenis lah. Kalau ambulance yang bergerak atas tanah, kita panggil ground ambulance lah. Alright. Other than that, you have a fixed wing ambulance. Fixed wing ambulance adalah kapal terbang. Alright. Helicopter ambulance, sea water ambulance. So once, let's say you dah click ground ambulance, you will come to the transport mode. Sama ada panggilan MACC ini adalah panggilan primary 999, okay, ataupun itu facility transfer, atau you tak pasti, atau lain-lain. So untuk case ni, obviously dia adalah panggilan MACC lah. Alright. So okay, so once you had click on the primary response, you check sekarang time of call receive, masa panggilan diterima, pukul berapa? Jom kita cek dia MACC. Pukul berapa panggilan diterima? Panggilan diterima pukul 6.10 pagi lah. 5/7. Alright. So panggilan diterima 6.10 pagi. So you click in. Okay. Time of arrival at scene. This also can be traced through your MACC notes. Okay. Times at scene is 6:20 AM. Okay, dekat section scene assessment on your case sheet tu, it is 6:20 AM. Okay, and time of departure from the scene. Okay, dah selesai treatment, time of departure. Time of departure is also mentioned over here. Pukul berapa time of departure? Ada siapa dah jumpa? Okay, time depart from scene. Dekat bahagian terakhir muka surat nombor 4, case nombor 4, muka surat nombor 4 ya, pukul 6.45 pagi. So 6:45 AM. So the data that you enter has to be accurate. Okay, alright. Okay, so next we go to the number 2, which is soalan ni adalah highest level of care provided on site. So what they mean by this is actually the highest proficiency of your healthcare provider dekat site. Misalnya you punya paramedik tu telah ditauliahkan, telah diberi sijil lah dalam let's say advanced trauma life support, so dia akan jatuh kepada kategori 3 advanced life support, but there's no doctor present. Kalau ada doktor dekat field, dia akan jadi ke level 4 advanced life support on scene, doctor field care. So ada there's presence of doctor or physician. Alright. Kalau rendah daripada itu basic life support, rendah daripada itu adalah community lah. Okay. So of course paramedic, if when they respond, they will do the primary triage at site. Okay. So untuk patient ni MECC telah triage kepada red zone lah, and they had already memang dah decided untuk red zone daripada MECC itself. So we click on red. And pesakit ni dia ada out of hospital cardiac arrest tak? Tak ada. Patient ni tak document as out of hospital cardiac arrest. So we click on no. Alright. So that clears our section number 3. Ada apa-apa masalah section number 3? Tak ada. Alright, if you don't have any problem with section number 3, we will go to section number 4, which is your emergency trauma care. Alright. Okay, so yang ini kita akan tengok time of arrival at hospital. Time of arrival at hospital, you can also check from your MECC notes. In this case, okay, patient, dia kat muka surat number 4, time arrived to facility is at 7:07. Nampak 7:07, and it is triaged to red zone. Yep, correct. Okay. And then the type of admission. Kalau case tu dibawa terus ke hospital oleh ambulance, 999 call, it is a direct admission. Okay. If okay. So when we click on direct from time call to a hospital arrival, dia ambil 57 minit lah. Dia akan, yang ni adalah auto generate. Kalau you there's some other options over there, transferred in to reporting hospital. Maksudnya pesakit tu dihantar ke trauma hospital yang ada trauma facility. Alright. Option number 2, transfer out of reporting hospital. Maksudnya pesakit dihantar keluar daripada trauma facility, mungkin ke facility yang lebih baik untuk dia punya treatment. Alright, reporting hospital means receiving hospital, receiving trauma hospital. Alright, and then option number 3 adalah transfers both in and out of reporting hospital. Mungkin pesakit tu dihantar ke hospital district, tapi kemudian telah dihantar balik. So in and out. And so bergantung kepada which option you click lah. Okay, tapi generally in MECC kita akan direct call, kita akan klik kepada direct. Alright. Okay. Alright. Next, number 4 is the initial ED triage. Okay, from your PAC and also your clinical notes, it is this patient is being sent to red zone. Okay, and then the final triage dekat ED pun dekat red zone lah. So of course this patient is not under triage. This is auto generated as well lah. Okay, so next we will go number 7. We want to know whether the patient ended up dekat mana dekat red zone tu. Okay, so trauma resuscitation facility use. So bergantung kepada facility where you come from. Certain hospital you have your trauma bay. So certain hospital you don't have trauma bay, you have shared resuscitation bay dekat red zone, so you have to click accordingly. And in certain centers where you have dedicated trauma services, macam dekat hospital Sungai Buloh, okay, dekat HKL, then you click dekat dedicated trauma service. Perbezaan dia adalah you punya katil is reserved, and also your manpower tu tak dikongsi. Kalau you berkongsi, you bukan dedicated trauma service. Faham? Okay. Alright. So number 8, activation of trauma team. Okay. So yang ni bergantung pada center again, whether there's any activation of trauma or not. Of course, for this case, because it is in Sungai Buloh, so memang trauma dan admitted to damage control resuscitation bay. So this and of course the trauma team is activated lah, tier 1. So kita akan klik yes dekat sini. So when you click yes, then you have to know what is the highest level of experience provider from the emergency department. If you look again at your case sheet, masa dekat dalam clerking tu, it is seen by consultant emergency physician Dr. R. Alright. Okay. No, tak best. Okay, so you click on consultant. Okay. Alright. Number 10 is your ASA PS classification system. Okay, yang ni you kena tengok kepada comorbid patient. Untuk soalan nombor 10, 11 kena tengok kepada comorbid patient. Okay, untuk pesakit ni, kalau you tengok dekat dia punya ED trauma clerking, it is clearly stated that the patient had no known medical illness, no known drug and food allergy. So patient ni ASA, before the trauma, he is a normal healthy patient. So ASA kita klik 1. And then Charlson Comorbidity Index, dia pun tak ada pesakit comorbid yang sebelum ini, kita klik kepada none. Okay, we click none. Aku klik. Charlson, yang ni none. Kalau ada comorbidity yang you detect, then you can click accordingly lah. Alright. So of course, if this patient has no known medical illness, tak logik lah kalau dia ambil anticoagulant. So patient ni pun dia tidak ambil anticoagulant, dia pun tidak mengambil antiplatelet. Okay, next, this data is compulsory and also important. Okay, adalah pulse rate upon ED arrival. Pulse rate upon ED arrival. Where do you get this data? Once dia tanya pulse rate, dia kena respiratory rate, dia punya BP, you punya SpO2. So this all can be retrieved ataupun boleh didapati daripada you punya trauma clerking sheet lah. Okay, so untuk pesakit ni, dia punya heart rate on arrival adalah berapa? 143. Alright, so key in 143. Untuk respiratory rate, pesakit ni masa dia sampai ke hospital adalah berapa? 18. Okay, so 18. Kita key in 18. Alright, first recorded oxygen saturation in ED. So saturation under room air pesakit ni adalah 88%. Kan? Nampak dalam trauma cutting sheet before they put on high flow mask tu 88%. 88. Okay, next we will go to the GCS of this patient. Again, trace from your trauma clerking sheet. This patient punya GCS adalah E3V4M6. E3V4M6. So as you notice, the GCS scale is also being automatically auto-generated. Okay, next kita pergi ke airway management. Okay, kalau if you screen or you read your trauma clerking sheet, pesakit ni dia tak di-intubate. So there's no endotracheal intubation, there's no SGA device inserted, there's no surgical airway inserted as well lah. Tapi patient ni on high flow mask. Okay. Okay. So one thing that you can do is you can click on others and then specify your high flow mask lah. Alright. So next we go to number 22, which is your breathing and ventilation punya management. This patient does not require any finger or neither thoracosynthesis nor a chest tube, so no intervention was done on breathing section. Untuk circulation hemorrhage control management. Okay. Apa yang telah dilakukan untuk patient ni? So from this one you have to trace back not only in the ED notes but also the pre-hospital care notes. Okay. What did the pre-hospital team apa yang dia letak? Dia ada letak pelvic binder ke? Yes, okay. So dia ada masukkan, dia ada letak pelvic binder. Okay, so patient ada bleeding wound dekat dia punya lower limb. Did they put an external wound compression dekat pre-hospital care? Yes, okay. So it is documented in the pre-hospital care lah. Okay, dekat muka surat nombor 3, hemorrhage control, you will see pelvic binder is applied, compression bandage is as well. Alright, so other than that, you can also see down there, they documented IV tranexamic acid 1 gram in 100 cc over 10 minutes was given at 6:30 a.m. So tranexamic acid is also given. All right. So there goes your and then a large bore catheter as well. Dia pun ada insert juga, single access. All right. Next, we go to number 24, which is your immobilization management. So pesakit ni, if you look back into your PSC punya notes, cervical collar was inserted and spinal board was also placed, as well as your limb immobilizer. So you click accordingly, tak ada masalah. Okay, number 6, advanced resuscitation intervention. Okay, if that okay, so this one most likely when there's advanced resuscitation intervention, it will be done in the hospital base. You trace back your data from your trauma clocking sheet. In this patient, there's no deep wound packing was done. There's no sclerotomy, no resuscitative section or thoracotomy, no burr hole, tak ada fasciotomy. Okay, no reboa or orbital decompression was done. So untuk patient ni kita klik no intervention needed for advanced resuscitation intervention. All right. Okay, next we go to the X-ray. X-ray, which X-ray was done? So the proper way of tracing which X-ray was done is actually to go through your X-ray punya film lah, which one is done, available or not. But in this case, we rely on the data yang X-ray yang kita order dekat plan lah. So over here dia in the case sheet dia kata dia order X-ray tibia fibula, the knee, pelvis, femur. Okay, so you can click multiple choices over here. Dia tak ada masalah. Alright, and then number 28, if there's any ultrasound done in ED, so they documented they had done fast once in ED, so you click on fast. If there's other, you can also click multiple choice over here. Alright. And this patient is also planned for a whole body CT, also known as your PAN CT. So kita click on PAN CT. Alright, next, number 30 adalah time and date for your first initial CT, which was done within the first 24 hours of arrival. So kalau you tengok case sheet, alright, you will notice that memang ada laporan CT dekat situ. Dekat bahagian atas, dia ada tarikh dia. CT dibuat pada 5/7/2023 jam 7:30. Okay, so you key in 7:30. It was done at 7:30. Alright. Okay, so it will auto generate lah the time from arrival to the first CT, 23 minutes. And then again, number 33, if there's any blood transfusion required in ED or not. So kalau untuk pesakit yang kita tengok case number 4, there is no blood required. So you click on no. If the patient requires blood, if your patient requires blood, you can click on the section of yes. And underneath that, kita cuba click on yes. Kita click yes untuk blood. Okay, so if we click yes, if your patient has blood that they need to be transfused, of course, you will come to this segment, okay, where whether it's a standard group and cross-match transfusion, a massive MTP, okay, MTP atau targeted transfusion protocol, or if it is unknown. So kalau let's say you click MTP, all right, you click MTP, and then automatically you also have to key in how many pack cell was given, your FFP, your platelet, and your cryo, right? If the patient use SAFE-O, should it be calculated under pack cell ataupun dekat mana? Whole blood ke pack cell? Kalau patient tu pakai SAFE-O sebelum MTP tu activated, kita akan kira dia di bawah pack cell. Okay, di bawah pack cell. So if you key in your unit above here, dekat bawah dia ratio tu dia akan keluar sendiri. Okay, and you can see below the unit is actually the volume in mils lah, berapa jumlah yang you bagi. Jumlah ni boleh trace jumlah ni boleh trace daripada you punya case sheet. Once you transfuse, the staff nurse will selalunya lekat dia punya data of that particular bag. Okay. Alright, so not only it will calculate the ratio, but they also calculate the volume. Alright. Okay, so untuk patient ni, there's no blood being transfused. Okay, next. Number 48 is the ED disposition date and time. ED disposition date and time, again, you have to trace from your hospital punya case. And for this patient, the disposition of to the ward is on the 5th of July 2023 at 13:30 hours. Pukul 1:30 tengah hari. Alright. So what do we mean by disposition from ED? Disposition of ED means that the patient is being transferred out from ED. Yeah. Wow. Alright. So over here, then the length of the stay tu dia akan auto generated. So any problem with section number 4?
Yeah, there is a question actually from Northern Region. They asked about section 4, question number 2.
Boleh, can we go
Section
scroll back?
4, question number 2. Transfer in and out of the center. What does it mean by that? What is the
Okay.
definition?
So in and out means, as I said earlier on, in and out maksudnya dia keluar from your hospital, it has been transferred out to another local hospital and being transferred back again. So dia in and out, dia pergi keluar dan dia masuk balik hospital yang sama.
So for example, if the patient is sent from hospital, a primary hospital, and then let's say hospital Kulim, sent to hospital Seberang Jaya to see the neurosurge. Then Seberang Jaya, when they key in the patient, they have to key in as transfer in. Okay, but let's say the neurosurgeon saw the patient and then say, oh, this is the patient for palliative care, and then send back to Kulim. So in Seberang Jaya, it has to be transferred in and out of the Seberang Jaya. But in Kulim, it's still not a transfer in patient, it's still a direct until the end of the patient. Do I need to repeat? Okay, if the patient comes from your district and to your, let's say you are tertiary hospital, and then to tertiary hospital, and then after some intervention done, and maybe this patient is meant for palliative care, or maybe just tender loving care, send back to the district. So in the tertiary hospital, this is the where you need to fill up as yes, transfer in and out of the hospital. Okay, and when you see the section 4 or many other sections, actually there are a lot of lines. You can see the number actually jumping. Why jumping? Let's test the Kuantan, because Kuantan also know how to enter data, right? Right, Kuantan?
Jumping up.
Why question number 1, 2, then jump to 4? Tak ada number 3 lah. Tak ada orang perasan. 6, 7, 8, and then jump. Kenapa?
Tak pasti.
All right. For this kind of situation is actually the core and extended question. If you go back to the first far up there, there's an option for core and extended. Can you go up straight? Let's say table 15, go up until the top. Go to the top. Go to the top, then you will see core and extended. Okay, so core, that means the required data by MTR center. All right, but if you put core and extended, then that comes all the data that you can put in. For example, some of the variables like if you want to know what is the transport time from the scene to the hospital, from scene to arrival to hospital. Sometimes NTR doesn't capture that because we know a lot of hospital doesn't, a lot of ED doesn't process the pre-hospital form in the clinical notes. So that becomes our not required data. But in Hospital Pulau Pinang, as for example, my center, my previous center, I want them to put in this data. So the pre-hospital has to come with the form with all the time there, although it is not required data by MTR center, but in Hospital Pulau Pinang, I want that data. So that MO or that particular doctor, nurse, or MA who fill out the data need to fill up the core and extended data. It means depend on your center, what you want to analyze. What you want to analyze in the end. Do you want to analyze the pre-hospital care in your time? Do you want to analyze whatever data that you want to analyze? just it is there for you to fill up. Either you want it or not. But core and core extended is core, that means required data by NTR central. That means at Sungai Buloh, we need that data. But extended data, you can fill up if your center needs that particular non-required data. Got it? Boleh Dr. Sofian from Kuantan, faham? That jump? All right, Dr. San from Kulim, boleh? Faham? Okay, cool. Dr. Teoh, back to you.
Marah pula microphone ni. Alright, next one. Section number 5, further management. Cepat-cepat nak habis dah, nak balik dah. Alright, further management. Okay, the first question to this is whether there's a first key emergency intervention. Apa maksud first key emergency intervention? Maksudnya adalah intervention yang dilakukan, intervention that you do for life saving punya procedure lah. So there's a few over here: damage control tracheotomy, pelvic packing, interventional radiology, your intracranial EVD, fasciotomy, pelvic fixation, escharotomy, craniotomy, limb revascularization, damage control laparotomy. Okay, all right. If it is done, you can either click. If you don't have that in the option, you can always click others and you can key in as well. All right. If there's no emergency intervention for this patient, macam pesakit nombor 04 ni, so we assume there's no there's no key intervention that was done lah. So if you click no, you will realize that the date and the time it will automatically be generated as 99999. Itu is okay because it is a background auto generation lah. Alright. So if you this is optional as well for our part, whether there's any procedure done or not. Okay, depending on your center. If this is pertaining to your surgical site, then if you want to list down the procedure, you can always look at the procedure operation yang you buat, and then you can key in the time, the date, and the name of the procedure and the findings lah. Correct. So that goes the section number 5. We go to section number 6, which is your injury pattern. All right. Okay, so as you can see inside your case sheet over here, okay, there are a few reports of CT scans. Okay, this is your radiological punya result. If it is being printed in such manner, macam kita diberi kertas soalan sekarang ni, alright, what you want to insert is the impression or the diagnosis that was given by the radiological punya team. Okay. Macam dia buat CT scan bahagian kepala kan tadi. So the impression is the left parietal occipital cephalohematoma. So that will be one of it. Okay. And then you gabungkan your the other findings lah. Okay. The other grade 1 liver injury as well with minimal subhepatic free fluid. Okay. Subtle right renal upper pole laceration, grade 3 renal injury, small splenic hypodensity may represent a contusion. So you key in dia punya impression. If you are in the hospital where you can access this report in a soft copy or in a digital manner, what you can do is actually cut and paste termasuk semua dia punya reporting yang secara detail tu ke dalam bahagian radiologi. Okay, understand? What I mean is macam ada setengah contusion or laceration, dia akan tulis berapa cm by berapa cm kan. So all that you can cut and copy and put in. If you are in a center where you can retrieve this reporting in a soft copy. Alright. Okay, so untuk operation notes, okay, you have to trace back what they have done in the OT. Okay, if there's any operation done, then the findings you can always key in the operation result as well. Okay, and of course this patient did not die, so the post-mortem results we will tulis as non-applicable ataupun NA. Alright. Kalau patient you dah masuk tapi dia tak buat operation, dia pun kalau dia boleh tulis non-applicable lah, NA. Alright. Okay, number 4. Okay, this is the injury pattern list. Untuk pesakit ni, when you want to key in this section, you look at the diagnosis upon discharge. Okay. Okay, so this patient has a fracture of the right acetabulum. So when you click, you find the region first, the extremity. Okay, and then acetabulum fracture. Okay, If you cannot find the proper diagnosis that was given and you are unsure, number one, you can always ask the pakar yang in charge untuk MTR ataupun any doctors that regarding the diagnosis lah kalau you tak pasti. Okay, otherwise macam this case we can put acetabular fracture, no further non further specified lah. Alright, and then you click on the right side, the add new injury. Kalau ada lagi kecederaan yang lain, you key in at the top part again. Okay, extremity. For example, this patient has a comminuted distal third fracture right femur. So you key in femur over there. Okay, distal third, distal. You find. Okay, don't worry about this AIS coding. This AIS coding at the moment, this is just an introductory part to the MTR. You will learn more in detail in this for this AIS coding tomorrow, together with the MyROS punya team. Okay, so because this AIS coding is developed by a non-clinician, so esok dia akan ajar kita lebih kepada on this AIS coding lah. Alright, okay, so for this example, femur fracture distal end also, so you add the injury. Alright, so once you add, okay, so dia ada banyak lagi kecederaan. Kita tengok if you want to key in, you can key in, no problem. But in the interest of time, we go down. So over here, once you key in your injury pattern, dia akan generate your total ISS and your total NISS as well lah, and your survivability, your survivability punya percentage. Alright. So this patient, if you have only these two injury, your survivability rate should be around 91% lah. Alright. Next, we go to section number 7, which is the outcome. Alright. So in the outcome, basically we have to summarize the patient lah. Kita tengok berapa, we have to look at what has been done overall in the hospital. So level of care involved during in hospital care. So in this patient, it involved emergency department, the general ward, and the OT. If the patient is admitted to HDU, you click on HDU and ICU accordingly lah. Alright. So this patient does not require any endotracheal tube intubation. Alright. And the events during the hospital stay. Okay, during the hospital stay, if there's any complication arises from the trauma, you can always click lah. Alright. Untuk pesakit ini, dia develop an infected wound. So yeah, you can either click on unplanned visit to operating room, or you can click on others and add as infected punya wound lah, infection of the wound. Okay. Alright. So untuk pesakit ini, survival status on discharge, whether the patient dead or alive. So this patient is alive. So we click on alive lah. And GCS upon discharge pun good recovery. We click on good recovery. Boleh eh? Okay. And hospital discharge date. Of course, you have to look at the discharge summary. So pesakit ni bila dia discharge? Ada nampak tak discharge summary dia? 25 hari bulan 7 2023. 25th of July 2023. Okay. They were discharged at 17:38. 17:38. Okay. So this is the discharge date. So once you have key in number 7, number 8, the length of stay is being auto-generated. So the discharge destination, you can have to key in. Sama ada pergi ke rumah atau rehab, that one you have to know. Alright. And this is auto-generated as well lah. So they included whether the data is included into the inclusion criteria, which I score more than 12. Okay. Alright. So once you have completed this number 11, number 11 ni dia auto-generated, and you can cross-check again on section number 8 lah. Yang ni you can cross-check balik. Can we scroll down on section number 8, submission validation? Okay. So these are all the things that you had keyed in earlier on. So you have to check back lah. Bahagian sini you boleh check balik dengan your data. Alright. So once this has been calculated, you akan tekan save and exit. Once you save and exit, okay, it is saved and you have to dispatch. Then after that you dispatch. Okay, so kalau you tak dispatch, dia masih akan jadi dalam pending lah. Edit, action edit, edit, green color. Yeah, click on that. Okay, we go down. Dispatch. Okay, so once you dah dispatch, then only your data is being sent to the registry. Alright? Okay, boleh Faham? This is the data entry so this is very important. Tomorrow you'll be given case number 1, number 2, number 3 for your data entry. And the 3 cases will determine whether your table will be successful or not. Dapat nombor 1 ke, nombor 2 ke, nombor 3 ke dalam kita punya pertandingan lah. Adalah hadiah-hadiah yang akan diberikan kalau menang. Alright. So with that, I think I would end my session. And it's the end of the day. Thank you for coming. Great to see all of you. And hope that tomorrow morning we will have you back again.